program is going to be, how the webinar is going to be. We're going to have different itineraries, and we're going to have a fantastic time.
Without any further ado, we have a plethora of speakers, people who have their skin in the game, people who are very, very vast in the field of mental health. So I would introduce them to you, and you would obviously be hearing from them in a few minutes. The first speaker we're going to be having on board is Miss Magdalene Osunde, and she's certified as an MSN, APRN, NP, and PMHN. Her area of focus includes evaluation. It also includes diagnosis and management of mental health disorders, medication management for patients experiencing depression. Mrs. Magdalene Osunde will be taking us on demystifying the concept of mental health and addiction, identifying the link between mental health and addiction. So, Ms. Magdalene, I think you can unmute yourself now.
Good morning, everybody, and I'm glad to be here with everyone. Can you all hear me?
Clearly, we can hear you.
Okay. First, before I became a mental health provider, I'm going to tell you a little background about myself. I'm an American, but before I became an American, I was in Nigeria, and I'm still in Nigeria, very proud of it. But I went to a school in Nigeria, and Edo State University, got a bachelor's degree, 1996, worked as an accountant before I migrated to the United States of America. Upon getting to America, I worked with Pepsi Cola as an accountant, and I enjoyed my job. Now, while I was working there, I saw that I had a passion in healthcare. And again, it was something I loved. So I went into nursing and became a registered nurse. Worked as a registered nurse in ICU, PCU, if you know what ICU, critical care. And after some time, tried mental health, and I saw that was where my love was. Now, mental health disorder is something that is very underrated in third world countries, especially like Nigeria. After working in a mental health facility in the United States of America, I opened my eyes and realized that so many people actually need to be diagnosed and treated. So let's go to the topic for today. We have so many people who are struggling with anxiety, insomnia, depression, schizophrenia, psychosis. But guess what? They're not being diagnosed. They are coping with habits. For example, I've had some people tell me, I can't sleep. So what do you do to sleep? Take marijuana, smoke some dope, and I get some sleep. At that time, when they're starting, that is a habit. I've had some people who tell me, oh, I can't sleep. So what do you do to sleep? I have to drink me a glass of wine or 2 glasses every night to get some sleep. They're struggling with insomnia. At that time, they're using habits to cope. But guess what? Habits soon become addiction. So what I tell people is, if you are struggling with anxiety, depression, psychosis, or anything, any mental health disorder, if you are thinking about not waking up tomorrow, you need to be checked out, you need to be diagnosed, and you need to be treated. I know too that a lot of people, especially men, they think that, okay, when they are diagnosed, and they are on medication, that makes them a weak man or less of a man or less of somebody. No. Yes, I have also heard that having no money leads to depression. Yes, it does. But have you not heard the statistics of how many people, rich, wealthy, who end their life every day? So even if you have money, if you have underlying mental health disorder, psychosis, depression, anxiety, money is not going to solve that problem. One thing will solve the problem: medication management and therapy. Now, I lived in Lagos before, and I've been one of those who actually jump motorway buses from one end to the other to make it to the place that you work. Looking back now, I see a lot of anger, aggression going on in some of those passengers in those vehicles. Sometimes people don't even know the reason they are angry. Some of those people, they need to be properly diagnosed. Having depression and anxiety or schizophrenia or psychosis is not because of what you've done in the past. Yes, sometimes whatever you smoke could make you start having drug-induced psychosis, but being treated, it's a deregulation of some neurotransmitters which are naturally occurring in the body. So if you go into anxiety and you decide, okay, I'm going to smoke, take me some dope to help me go through it. No. Go get checked out. You need your serotonins to be regulated. Over here, we have a lot of medications that are FDA approved for certain disorders. Okay, I see some people, or I heard some people, they come into work and it's a lot of anxiety, a lot of anger towards their subordinates. Sometimes they're having some mental health disorders which they cannot disclose. So some people like that, you want them to be checked. First, you want to make sure they are getting adequate sleep. If number one reason is insomnia, you want to make sure you take care of their insomnia. If their second reason is anxiety, you want to make sure you give them something for anxiety. But guess what? There are medications that will take care of both the insomnia and the anxiety all in one pill. And even conjunction, depression, all in one pill. So I urge anybody who knows anyone struggling with anger, anxiety, insomnia, if you can't help them, direct them to see a psychiatrist, a physician assistant, or a nurse practitioner. Because you never know when your advice may actually be saving somebody's life. Not just saving that person's life, saving their family's life. I've seen some people who come to work, all they want to do is to just be unnice, mean to their colleagues. Some of those people, they have underlying anxiety. They have anger and aggression. And a lot of those people, they need to take medication. Let me tell you a popular story, which I used to tell patients. Before I opened my practice, I used to work in a county hospital. Parkland Hospital was one of them. And I tell patients who come in there not wanting to take their medicine, I tell them, I said, look, ma'am, The reason you are probably locked up in this facility and we all are trying to give you medication is probably because you don't take your medicine at home. And I tell them, here are doctors, nurses, nurse practitioners writing these medications for you. But guess what? They may actually be taking more medications than you will ever need in your life. So in a nutshell, when our mental health is well and appropriately cared for, we can do better and we can even help other people. So I know that my time is up, so I'm going to have to end it here.
Okay, yeah, thank you very much, Miss Magdalene Osunde. Amazing one. The fact that you made mention of the fact that people who are going through insomnia should seek medical attention, and also call the attention of therapists and people who are mental health specialists. Sometimes people just feel that, hey, I just walk down to the nearest pharmacy to get a drug so that I'll be able to sleep and self-medicate to get proper health care. But I love the fact that you're coming from a perspective of people seeing that having mental health issues isn't somewhat of a big deal. It's something that literally everyone goes through. And so we should, in one way or the other, seek the services of people who are experienced like yourself. Also gotten a couple of someone who is experienced as much as worked in the US and all that. Amazing session, amazing one, Miss Magdalene. I must say thank you very much for that time well spent. And the next speaker we'll be having on board is Miss Unwana Etobong, and she's experienced in the management of individuals with psychiatric and mental health disorders, ranging from personality disorders and mood disorders, anxiety disorders, personality disorders, psychotic disorders, eating disorders, and trauma-related disorders, sometimes substance abuse, addiction disorders, and other mental health-related issues. So I would love to have Miss Unwana Etobong as a speaker, and she's going to be taking us on a journey. She's going to be taking us on identifying signs of stress, burnout of home and work, and the next step. Can you join us, please?
I'm just going to go straight. What is health? Because when we want now talk about stress, which is one of the mental health disorders, we have to know what is health first. And by the WHO, we know that health is the physical, mental, and social. So it's not just one aspect of a human being that needs to function effectively for that person to be healthy. So it has to do with the physical, the mental, and the social. So you waking up and having a good people around you, having a good society to strive on, also affects your health. Then when we talk of mental health now is that ability for one to cope with his or her society, ability for you to be able to exercise that your coping mechanism, you be able to be productive, and not just being productive, and your way of life has to be acceptable to that particular environment that you are find yourself. Because what I'll find normal in my society might not be normal in your society. So when you're talking of mental health, you have to make sure it goes with the norms of that society. The ability to adapt to stressors in our environment is what makes us mentally healthy. Then what are we talking about mental illness? It's the way we are unable to function in those areas. We have a maladaptive response to stressors, both internal and external in our environment, feeling that heaviness, unable to think and able to relate with people in the society, and then go ahead with your job. Those are the things that we see and we find out that, okay, this person is definitely in one way or the other mentally unhealthy. Then there's some lifestyles we can go on with that will help us with our life to go on properly with our mental, physical, and social well-being. Then we talk about exercise or eating habit, a healthy lifestyle, know where to be at the time and know where to be, where not to be, reducing stress, which is our main topic today. And that will be our focus today. So stress is a key risk factor in addiction. Yes, that takes us to that most of the time when one is exposed to stress, that's where the individual finds himself falling into that space of addiction, because the person is trying to cope with those things that he or she is unable to manage with his own willpower. And most times we even need others around us to help us to get that coping mechanism activated. So with the statistics, we find out that 3% of people report with extreme stress in our society. Yes, you can imagine that. We just see this individual going on and you think all is well. You don't know what the person is going on. Maybe that day that person was able to get to work at a very late hour and he's being disposed of his job. That's a stressor. Or that individual was driving on his way and the car break down. It stresses us. So like I said, it's always around us. But how do we cope with those things despite its availability? And we find out that women are prone to it more than because they try to stretch hand to everything. Their career is there, their home is there, the parenting is there, everything comes together, and they just believe that they can't do that. That is where it now drives us to how do we cope with all these things in our environment. And what is our stress? Stress is a state of worry, tension, feeling difficult to cope with a particular situation. That's what we call stress. Because most of us, we find we want to tempt stress to be only when one is overwhelmed and is unable to function in any other aspect. That's what we see as stress. As easy, as simple as you unable to communicate with someone in a very good manner makes it difficult for you to cope with stress. And we'll go to some causes of stress. Most of us, if we find it difficult to accept that we are stressed, especially in our today's world, I will specifically make mention of Lagos. Lagos, we see people going on some level of stress that you can't imagine, and they just believe it's normal. So they get addicted to stress. It's just the way they live. They're not minding what is actually going on in their system as at that time. So some things that we're going to see within us that will make us understand that we are actually stressed is when you talk to that person and you find out that that person, you're just asking someone, how are you? We see that every day on the street. How are you? Must you ask me, how are you? Because you don't know what that person is going through at that time. The person gets easily irritable, angry. The person can't stand you talking for 2 minutes. Please, can you just let me get out of this place? Overborne, overwhelmed. The person just, where am I? What is happening? Anxiety also is one of the symptoms of stress. Racing thoughts. When you think all over again. You can imagine those days that you sit down and you're thinking and the thing is coming and you're just there in that world of yours. That is stressors. Because most of the time we find out that those things are things that we can't even resolve. And there we are, deep in it. So one of the stressors is equally being in that space of unresolved situations. Unable to enjoy yourself, you know, find out that nothing works. What's it for? Why should I be here? Why will I go there? And all those things. Those are some signs that you find out that one is being stressed. Depression comes, that's even the extreme of it. When other measures have come and the person ignores it, those negative signs, the red light comes and the person ignores it, then you find out the person lose his senses of belonging. That depression comes in. Then it comes to loss of humor. The person does not find, at that environment, there's nothing pleasant, nothing happening around that individual. So many things. When it gets to the severe cases, you have someone with rapid heartbeat, with pain, nausea, you have diarrhea. It gets to that because if you are stressed, you tend to make your blood vessel constricted abnormally, and it has to also has effect on other organs. There you find out that the individual is just not having his system working. And there's this thing in health, the mental health, that we call psychosomatic, where your mind affects your body. You just find out that because of the stressors that you are being exposed to, your system starts responding negatively just because of that. Some people at that moment, that's where they eat much, that's where they eat much, that's where they stop eating and all those things. Some eat excessively, then procrastination also, when you find out that I can't do this, you just become irresponsible. Then one of the severe causes, which some of us ignore, is insomnia, inability to sleep. With stressors around us, and we not developing a good coping mechanism against it, it steals our sleep, it takes away our sleep, and then we can't imagine the outcome when it gets to that stage. Research has actually proven that most of individuals that are found in the space of addiction are those people that have been exposed to stress in one way or the other, either when early stages or later in life, and they were unable to develop a coping mechanism to overcome it. Then we get to what's called addiction. When we get to addiction, that is when an individual finds himself dependent on a particular substance, that's compulsive, particular substance, despite its negative experience and effects. They don't mind the consequences, because there is no individual that is addictive to anything, any substance that has it pleasant. They see it, but that is where like their life depends on. So they just find out that, okay, if I must live this next minute, this is what I need to do, because that's what keeps them at that stage where they perceive they are okay. Some addictive behaviors we find ourselves in this society: gambling, sex, risk, food, internet, which is something else today, mobile devices, shopping. Yes, some people, they can't save. Some people are addictive to spending. You can't imagine that. There are individuals that they can't pad their resources for anything. They just want to get that thing done. And so many other substances. We know of the cannabis, the cocaine, and all the substances. When we now talk of this thing, how do we manage? Because that is where it comes to my field as a nurse, the management of these conditions. First of all, my duty and what we try to do is to make sure the individual identify this problem. It's only a problem that is identified that can be solved. If not identified, it can be solved. Then we identify the triggers. What is this thing that exposes this person to stress? And try to withdraw. Try to psychoeducate, help this individual to make sure he can leave this particular thing and then get a substitute for this particular lifestyle or exposure. Then another thing is breathing exercise, which will also help in circulation and then alleviate what the stressors is. Meditation, yes, they will go back to where we say our God, because most times some of the stressors we experience are those things we don't even have power over, and we dwell in it. So we should at least understand that there's somebody out there outside of ourselves that can handle some problem. That is where our meditation comes. Then eat healthily. Also, change the environment if there is need for. If you find out that the environment is the source of your stress, then why not change the environment for at least for you to be healthy and live a good life? Exercise regularly, get plenty of sleep. Sleep is very, very essential. We here in Lagos, please, let's have a time out to sleep as much as we can. Avoid alcohol, anything that you think that is going to increase the stress rate. Seek professional support. I come down to this particular aspect. We know with our misconception in our society, we believe that everyone that goes to the mental health facility is actually deranged or must be someone that has been naked on the street. No. Even at that stage that we can't sleep, that we can't eat well, please, you need to seek the professional advice. So make the hospital, make your health professional your friend. Then accept the past. Yes, there are some stages we just need to walk past. We could only refer to them for correction or on how to make things better, not living in that past. That is one of the things that most of us have lived in. So like you can see now, we talk of exercise. We have so many things that exercise can help us. We increase our, improve our sleep, we reduce heart diseases, we control our weight and all that. Oxygenation, which is very, very vital. Because as much as you exercise yourself, you have more circulation, then oxygen gets to your system, then metabolism takes place. You detoxify those things that are abnormal and then are like a neurotransmitter that can have negative impact in your system. We've talked of healthy diet. Avoid your negative persons around you. It's very, very important because most of us, we've seen that we compromise because the family member, because it's this. Please, there are ways to at least give these people their space so as for you to live. Because if this person is a source of your stress and you remain in there, you will find yourself in a position where this individual won't even be around to help you out. So try to make sure you leave that environment. Your social well-being also is very well. Please interact. There is nothing you're going to tell anybody that have never happened and that will be the last to happen. So please, as much as you can, relate to people, air out, open up that container which you're fixing in all those stressors, those things that comes in overwhelming to you. Because I try to illustrate our mind to be a container. My size of container is not your size of container. And what you have in there will have impact. Wait. So when it overflows, that's when we start seeing the symptoms of mental health coming. So as much as you can, please empty it so that you have more space to put in so many things that you still be exposed to with time. Then we find out that when we are socially inclined and doing well in our social life, we have a good and healthy endocrine system working for us. We have better response to stress because that thing that you're going to tell me, I might not really have a solution for it, but I could tell you from experience, those people that who have gone through that particular a condition and how they were able to come out on it. So at this moment, I will want to conclude by saying that our busy lives makes it easy to be overwhelmed, thus exposing many to stress, which if not well managed, drives one to addiction, which I think none of us should be exposed to that extent. Considering the current global economic downturn, which has added even more stress to our daily life, I advocate for slight start. Don't mind a little beginning, yet impactful, healthy lifestyle adjustment. Please just make a trial. Seek help, meet professional. One step at a time, yes. You just need to take one step at a time. These small changes will add up to time to compound to a great result. Just make sure you keep it at that little effort. Even when the going is tough, avoid stress, stay healthy and stay alive. Thank you.
Thank you very much for an amazing session. I love the fact that you made mention of we having to avoid negative people, we having to do all of that. Also addressing the issue of sleep and triggers, things that trigger your mental health. So I'm sure a lot of listeners they've heard that. So the next speaker we'll be having on board is Dr. Obatomi Olalade. Dr. Obatomi Olalade. He's going to be taking us on stakeholder approach and management of priority conditions. Stakeholder approach and management of priority conditions. Dr. Obatomi Olalade is a fantastic doctor. He's a medical doctor, a psychiatrist, a mental health advocate, a public speaker, and he's experienced as a resident doctor with which he's been able to demonstrate history of working in the hospital and healthcare industry. Skilled in public speaking, meaning we're going to enjoy his session also, since he's a skilled public speaker, and also mental health counseling. He's and also in child mental health, substance abuse prevention, and substance use disorders. Strong healthcare services professional with a Bachelor of Medicine and also a Bachelor of Surgery, MBBS, focused in medicine from Ladoke Akintola University of Technology. So he is a medical practitioner, he's also a medical doctor, and with key areas in mental health counseling and substance use disorder. So I would love to welcome Obatomi Alalade. I would love the listeners to please comment on the comment section as our speaker comes on board. Just a round of applause, sending your messages and make the comment section very much interactive as we welcome Dr. Obatomi Alalade. Dr. Obatomi Alalade, can we have you on board, sir?
Okay, thank you very much. Good morning, everyone. Good morning to the audience and the host of this meeting. Thanks a lot for having me. My name is Alalade Obatomi, and I'm a psychiatrist. And I'll be discussing stakeholder approach of management of priority conditions. I have an outline of first introducing generally what mental health is, talking a little bit about the burden of the illness and the different subspecialties of problems that may arise from there before we move over to the stakeholder approach of the whole thing. Any opportunity I have where I can really talk a little bit about mental health, I try not to let it go away, but I'll also watch our time to make sure I don't spend too much time. So generally, we all know that mental health is more than the absence of a disorder or disability, and it's an important component of health. If you check the slide, I tried highlighting very important aspects in the definition of mental health, so as to let us know that one way or the other, it's very important, and a break in any of these definition or important terms in the definition can lead to an illness. It's a state of well-being in which an individual realizes his or her own abilities, can cope with normal stress of life, work productively, and able to contribute to his or her community. Now, those four things that were highlighted, if there is a deviation from it, then it can lead to a mental illness. Let's take, for instance, stress that was just discussed earlier. In the definition of the mental health, it says can cope with normal stress of life. So it's expected that we go through stress. But the problem is when we don't cope with the stress we go through, then they can lead to a mental health breakdown. So someone that can't cope through the stress of the society or stress at work can probably now come down with an anxiety disorder because you are afraid going to work, your boss is going to talk. And then it comes down with anxiety. That person at that moment has a problem with his or her own mental health, and it's important that it's managed. So mental health is critical to a person's ability to think, operate, interact with the environment, and a living and enjoy life. In the past, we see naked or half-clothed individuals roaming on the streets, and back then we refer to them as lunatics. Even now, we don't see them that way, and we have a different perspective in mental health, which we are trying to portray to people. Now, that's the perception people used to have. But at the end of this presentation and discussing with stakeholders, I also want us to see it in a different light. Now, we know that about 30% of the population has a mental disorder. In fact, in Nigeria, they mention 1 in 4 has a problem, mental-related illness. Now, having the illness does not mean the person has the disorder. So I have anxiety, does not affect my functioning. I have a depressive disorder, does not mean I'm not moving on or I'm not still functioning if it's not a severe depressive problem. There are a lot of people abusing cigarette and alcohol and are still functioning, but then they're already tending towards having an illness or a disorder, as the case may be. So there are different varieties of it, and it has been estimated by the end of this year, there will be so much common mental disorders like depression and anxiety, which we've been seeing in our clinics. Like I mentioned earlier, 1 in 4 Nigerians and about 10% of mentally ill Nigerians have access to the care they need. And this is very important for us as stakeholders to be able to now look at where do we play a role or a significant role in increasing the number and percentage of people that do have the mental illness can access care. Because if only 10% of mentally ill Nigerians have access to the care they need, that means we have 90% that are outside. Now, these 10% are only those that can reach the hospital. So that means those that are probably in the hands of a quack or in the hands of somebody who doesn't know what to do or probably somebody who is being changed somewhere, they are not part of this 10%. So as stakeholders, how do we increase the percentage from 10 to at least we move to 30 and then 50 and upwards as we go? Now, majority of those who need mental health globally, they don't receive treatment. For low and middle income countries like Nigeria, about 76 to 85% of those that have mental health problems don't receive any care at all. And so they are just moving. There is nobody to help them. They are suffering in the hands of people that are chaining them, beating them, or probably telling them that it's a spiritual thing and have to pray and fast for the rest of the year and everything. So the treatment gap for low and middle income countries is definitely very high. And we can see it in the level of personnel, which also affects it. Like, for instance, now, I know that from the Association of Psychiatrists of Nigeria, we have about 300 psychiatrists in the whole of Nigeria. And with 300 psychiatrists taking care of 200 million people, now that's not to say the 300 are all in the country at the moment, because some, because of the Japa syndrome now, may not be in the country. Same applies for other stakeholders, the nurses, social workers, and every other people. That's why it's important that we spread the wing and have other stakeholders like the church, the religious bodies, and everything to fill in for this treatment gap and know when it's necessary to refer. Now, I just put this slide just to recap to let us know that mental illness cuts across so many areas from childhood to adulthood, and not necessarily about the person walking on the street clad naked. For a child, the child can have an autism spectrum disorder, problems with communication and interaction. It could have ADHD. At some point, it became a rave on Twitter where everybody was saying, oh, it's like I have ADHD. Well, I was just smiling, having to see all those things, thinking that, well, having problems with hyperactivity is not synonymous with ADHD. But yes, a child could have ADHD, which is affecting his functioning in school, place of work, and everything. There could be conduct disorder. So you see a child very difficult in obeying, always disobeying, breaking rules, setting fires, killing things. Could it be a conduct disorder? Developmental problems, inability to walk at the right time, to talk at the right time. All this could affect a child, and they are under the spectrum of a mental illness. Just to let people, I don't know the group of audience we have, to let you know that yes, you could have it in a child and not necessarily an adult. Now, there are eating disorders. You have people who want to be like, want to maintain a particular shape and size and say, oh, Beyonce is my model, or I like the way Rihanna looks and I want to be like her. And then you come down with anorexia nervosa, bulimia nervosa, and we are dealing and battling with eating disorders. Adjustment disorder is also present. Some people could actually get married and have an adjustment disorder because you have to now change your lifestyle. Oh, I'm married now, or a woman, I the other. People come down with adjustment disorders, which could become a problem. Anxiety, very common. Fear, sleep problems. So those of us that can sleep appropriately, we should give glory to God, because there are a lot of people that have sleep disorders, either excessive sleep or even not sleeping at all. Insomnia, parasomnia, they could also be there. Substance, which is the rave of the moment, abusing alcohol. Alcohol, by the way, is a substance for those that drink alcohol, and could come down with a substance use disorder. There are personality problems. So you see this person at your work, very difficult and everything, and you are wondering, is this person okay? It may be a personality disorder, schizophrenia. For the elderly ones, dementia. Mom is forgetting things, can't know where things are, and you are just like, what's wrong with this mom? It may not be only old age. The person may actually have a dementia. So having looked through the spectrum, what exactly are the causes and what's our role as stakeholders? We know the biological causes, which are common. Genetics play a large role, just like you can have hypertension inherited or diabetes inherited. Mental health issues can be inherited. You remember back then, our parents would want to know the kind of family you want to marry from, to be able to say, oh, they have this in their family, don't marry from them. It could be because of these genetics for mental illnesses, loss of loved one. Absent father figure has been shown to play a very large role in it. A lot of times we talk about social problems, relationship issues, unemployment, serious traffic causing stress. Currently now, Lagos-Ibadan Expressway, you spend 6 hours, 7 hours in traffic. That is a stressor that can actually lead to a mental health breakdown. And that's why mental health is so important. And it's not something we can overemphasized. So all this could be there. We manage them with different ways, use of drugs, therapy sessions, and we address the social issues as important as how we deem fit. Now, who are these stakeholders that are very important in managing this mental health? The truth is, number one, all of us are stakeholders. All of us are important in managing this thing. The community, the person working on the street, your friend, your parents. There is nobody that is not important as a stakeholder. Now, part of the reason is this. Sometimes for mental illnesses, it takes other people to identify that there is a problem, as the individual themselves may not be able to know that they have a challenge. So it's when you are now discussing or observing, because mental illnesses could be a behavioral, it's more likely a behavioral disorder. You won't present in front of me and most likely I'll say, oh, go do this test. It will help me know the mental illness you have. No, it's from the discussion we have, the behavioral change. I'll say, oh, most likely you have a depressive disorder. And that's why everybody is a stakeholder. Everybody needs to know about mental health. Everybody needs to know the signs and symptoms so that you can pick and then appropriately refer. So stakeholders are quite much, right? Community, parents, social workers, doctors, nurses, occupational therapists, religious leaders, because a lot of times, because of the kind of country we find ourselves in, and because we are very religious set of people, you first think it's a spiritual illness, and then you spend so much time with the pastor, spend so much time with the imam, and then they talk, and probably when it's not abating after a long time, there's a delay, and then you present in the hospital. So everybody is a stakeholder. Everybody needs to learn about it so that you'll be able to know appropriate referral and when to leave things, when to get things done, when to say, oh, no, I can't do more than this. So you are in church and you observe this person comes early to church, comes regularly. He has stopped coming for the past 3 weeks. Then it's a source of concern in the religious organization, the community. There are communities here in Lagos that at some point, there was a community that brought in a woman to the hospital because they just felt like, we keep seeing this woman around and she doesn't seem to be okay, the way she dressed, unclad and everything. Okay, fine. They brought the woman to the hospital and trust me, they paid for the bill and has been supporting her care to make her even integrate with her family members. And she's much better now. So community also has a role. You won't just neglect the person you see along the street regularly and say, oh, let the person just be there. It might lead to complications later on in future. The government has a role. A lot of times there are a lot of policies in Nigeria that are not implemented as related to mental health. And that's why the government too is a stakeholder. You listening to me right now is a stakeholder in mental health, because the more you know about it, the more you can reduce the stigma that is associated with mental health and make people say that it's just a component of health. It's just a part of it. The WHO definition of health includes mental health. And so that is why all of us are all involved and must work together without any form of rivalry or interprofessional problems or bias, so that the patient will be the center, or the person we're addressing will be the center to see how we can work well with the person. Now, some things that are very important, especially for stakeholders. Number one, which is very important to me, is to know when to refer. I was in the church program and then they asked me, they said, what's the difference between a psychiatrist, a psychologist, a life coach, a counselor? They mentioned several names. There are so many names right now, and you need to know your role and when to refer and when to say, I cannot do this thing, and when to say, oh, we need to see a next level. It's very important so that we don't overkeep a client and so that we don't lead to the case being worse. Right now, I'm so happy with some churches around where I work who have been able to recognize the signs and symptoms of this illness. And when people first come to the church, you say, oh, we want to pray, it's a spiritual thing. Once they pray for you within 1 week and you are not getting better, they bring to the hospital. Doctor, help us assess this person. Let's know if this person is okay or not. Even some white garment churches, we have some kind of alliance with them who brings them in. And I like that. We're not saying there are no spiritual causes to illnesses. We're not saying you cannot pray, rather, not spiritual causes. We're not saying you cannot pray. However, when you know, oh, this is my limit, then you come. So we have that thing involved with them. Know when to refer. Recognize that there's no rivalry. The whole thing is about the patient and the client getting fine. Very important. Even we work sometimes with traditionalists because we know that in our culture, people still go to meet them. Oh, please, oh, this person is this. And they chain them there and everything. But occasionally we do outreaches where we have to talk to them and say, Baba, It's not just about holding this person down. You can also come to the hospital and we'll work together to see that this person is much better. Again, basic trainings everywhere, important lectures, let people know what you've learned so that everybody can recognize these symptoms. There are people, even educated, don't know that these are signs of an illness. We also need to support each other. A lot of our policies have to be integrated into the primary health care. For instance, I work in psychiatric hospital, Yaba. You are bringing every patient from everywhere to the hospital. The burden is much. The doctors are few. The nurses are few. But if you integrate it into primary health care, where people can go to an health center and you can train the healthcare workers there how to recognize where to refer to the secondary healthcare level, you have personnel that can take care of it. It reduces the burden on the top. So it's easier for somebody in an healthcare to be able to say, oh, with this woman, she has a postpartum depression. You can quickly recognize right from their primary healthcare. Rather than waiting for complications, you are now waiting till when the person gets to a psychiatric hospital. So we have to make our primary healthcare functional. We have to make the general hospitals very functional so that everybody in different locations can see to it and know when to refer to say, oh, it's beyond us, let's go there. For instance, there are patients that come and they've been stable, and what you do is to refill their medications. If the primary health care is very functional, you can send that kind of patient back there and say, oh, keep managing in the primary health care, where it's much better. Then also favorable policies, implementation of existing one. Well, good thing about it is in Nigeria, just recently, as recent as 2 months ago, I think, the mental health bill was passed. And so patients have more rights. The healthcare workers know what and what not to do and when to do what. So it's very important, but much more than passing the policy is the implementation of the policy. We all need to support each other. We all need to continue with training and retraining ourselves so that we become better and we can know what to do with counseling. Generally, tips to promote mental health. Very important that I tell people, please know what is in your control and what you cannot control. You cannot control, for instance, I'm not a politician, but just to give an example, you can't control that Bola Tinubu is the president-elect. So don't worry yourself too much and start fighting and start having discussions. You are stressing yourself. You are affecting your mental health because you will be disturbing. Just your own is to see how you can position yourself. Things you can't control, please leave them out of it. The ones you can control, work on it. When we had COVID-19, a lot of people broke down because they became excessively obsessed about it. You can't control the fact that it's already happening in the world. But what can I do in my local space? How can I take care of my hygiene? How can I make sure I don't get the disease? That's what you can work on. So the things you can control, work on it. The ones you can't control, leave them. Please learn to stay off social media once in a while because social media could be very toxic. It's very important. Learn to get the appropriate news. You have to build your psychological resilience about different things and different issues. You need to know when to step away and when to continue. You need to know when to stay back and when to continue. There are days in which I just decide and say, I'm not going on Twitter because everything over there is just being news up and down and it's worrying me. And I stay off it. There are times I stay out of CNN because every time is bad news. I don't want to listen to that. Something positive, a positive podcast. All this is very important. Speak out when needed. Learn to know when to refer. This directly to, in case you have anybody or probably a religious person on the line. I see this a lot where, you're already worried that this person is old enough, should be married, it's not married, and you're talking, where's your husband, where's your wife, what is happening to you? Sometimes this thing could be more damaging than positive. And so we should find a way to present issues. We should make sure there's a rapport, a relationship, or else, trust me, there are people that some of these things and with our approach is affecting their mental health. Don't personalize a global event. Something that is happening all around. Don't take it too personal. It's happening to everybody. So don't personalize a global event. Take breaks and vacation. Nigerians are bad in taking vacation. Even when you're on leave and they give you leave at your place of work, that 1 month leave, you're still thinking of a business to do, or you're thinking of how you want to quickly also to make some money. It's a leave. It's meant to make you relax. and then we're energized to work again. You know, plan for all these things is very, very important. And for those that engage in spiritual activities, it's also very good. It could serve as a coping mechanism for some people. Is important. Please don't indulge in psychoactive substances because it does more harm than good overall. In conclusion, many people have mental health concerns from time to time, but the mental health concern becomes an illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. There's no shame in seeing a mental health specialist. And always remember that mental health is well. Trust me, if you take good care of your mental health, other things they are most likely to fall in place. And I can assure you, there are plenty of people in the society that have mental illnesses, seeing specialists, and they are doing fine. And you cannot know by just looking at their face. So please, let's reduce the stigma. And thank you for listening.
Thank you very much, Dr. Obatomi Alalade. Fantastic one, if you ask me. A very, very fantastic man. Mental health advocate. He's a medical doctor, and also he's experienced as a resident doctor and skilled in public speaking. You saw that. We have Miss Angela Chizzy. Miss Angela Chizzy is the head of school, CLI College. And by the way, Miss Angela, I was going through the question and answer session. Somebody asked, what is the meaning of CLI? So you might want to put that in whilst you're taking us through as to the programs you have, or you guys have on board, the forthcoming programs, and how people who are interested in being a part of the CLI community or being a part of the CLI programs can be a part of it. So you want to come on board and take us through on this roller coaster ride as to all we need to know about CLI and also the programs you have on board. Miss Angela Chizzy.
Okay, good day. Thank you, Frank, for ushering me in. And I've been having an amazing time, and I'm sure our audience across wherever you're listening from, you're also having a good time and also learning. So CLI College is a place to be because it's Career Learning International. And as you all know, for the ones in our CLI community, it's a college that is looking at the needs, the current needs, where we need to bridge gaps. That's what we do most in CLI College. Now, this mental health and addiction space is one thing we want to come into because, like we've heard from all our speakers, it is the next ticking time bomb waiting to explode. And then, because that is what we know how to do best, we look at where the needs of the entire populace, the world globally, and we try as much as possible as an institution to help bridge the gap by carving out something for people to do and where they can help. Call it our CRS. Yes, it's a school, but that is a way we are also contributing globally to the entire populace. Now, CLI College is introducing in another beautiful one in the space of mental health and addiction. Ours is a program that is mental health counseling. And this program is just in the space of 2 months, which is 8 weeks, you become a mental health and addiction counselor. You can contribute your quota, your giving talents, and also being technically and professionally enlightened to fill this space by coming on board to join us on this program. And you might want to ask, where can I work? Thank God that Dr. Alalade has mentioned some couple of places, but the workspace is limitless because of needs. You could work in a school as a counselor. You could work in hospitals supporting psychologists, psychotherapists, and psychiatric doctors and healthcare workers. You could work in the church. You could work in the church, in the teen church, in the adult church, because 1 out of every adult, every 5 adults you see, it is going through one mental stress or the other. Atypical of living in Lagos, like they said, Lagos is stressful, whether you want to acknowledge that fact or not. Starting from the day you waking up in the mornings and facing the day, the traffic, the stress of work, coming back in the evenings, the cost of living, crime, and so many emotional baggages. So there are a whole lot of places you could work. You could partner, you could work with your HR in the office as a counselor. You could also work with the health safety and equipment, HSC managers. In fact, these are the people who need it, because half of their workforce, or half of their employers in their workspace have one mental issue or the other. We are not saying mental problem, like Noswana enlightened us. Mental stress, either from home, either from work, either environment, either the kind of friend. A whole lot of things can make one get into that space. So places where they can work, like I said, is limitless, and there's a huge need or gap for this. So we are looking forward to seeing you as you come on board to join us in CLI College to come and undergo this professional training, when at the end of 8 weeks, which is 2 months, you become a certified mental health and addiction counselor. And that's where you'll be able to contribute your quota as a person to this menace that is about to take over the society. So I urge us all to join us. And how would you be part of it? At the end of this, there's a link that will be shared where you just click, one click on the link, everything you need to know, how you can join this team is already available for you. And we are going to take a very quick look at what our Vice President CLI College, Kaden Campbell, Canada, Vice President CLI College Canada, Miss Kaden Campbell, is going to also tell us what she knows or what she feels about mental health and addiction. Please let's quickly watch this video. And at the end of it all, I'll be back again to say one or two things, and we can put a wrap to this whole webinar. Thank you.
My name is Kaden Campbell, Vice President for CLI College Canada. I've been in the education sector for over 20 years and is a registered practical nurse since 2016. A mental health and addiction counselor is somebody that actually provides guidance and counseling to people who have mental health issues. So there's a misconception when it comes to who has mental health issues, and people think that people with mental health issues are those that walking up on the street, talking to themselves, laying on the sidewalk, but that's not true. Every individual, most individuals that I know have a mental health issue, whether it be anxiety or depression or other health issues that require medical assistance or medical treatment. Not only can they work in a traditional setting like the hospital or a psychiatric ward, but they can work in social settings, whether it be in schools, in group homes, in youth services, or whether in the community, just counseling people who need somebody to talk to, because you can talk to anyone, but are you really given the right advice? So employment, you can find employment in the settings that I've mentioned below, in schools, in the community, in social settings, even your bartender can be a mental health counselor, because most people go to the bar to drink their sorrows away, but if they have someone to talk to, if the bartender is trained, then they're better able to have better communication with the person who is actually drinking away their stress. 5 things you need to know about mental health and addiction. A mad person walking on the street is not the only person that has mental health. A person who smokes weed or crack cocaine, that's not the only addiction. There's addiction to porn, there's addiction to so many other things out there. And if you constantly or you can't do without something, that's an addiction. And next, we have to break the stigma when it comes to mental health. And the only way you can do it is to actually take a course to understand what it's like. And to do that, you can click on the link below.
And thank you, audience, on this webinar. So you've heard from our Vice President Kaden Campbell on what mental health and addiction is all about. Now, as a mental health and addiction counselor, you are like a first aider, if you must know. The very first port of call, anybody going through this stress or pressure gets to talk to, and you'll be able to counsel them and do what we call upward referral, telling them where to go to seek help, because a whole lot of people out there are going through this, but basically they don't even know where to turn to and who to seek help from. So you are like the first port of call, the one who gives succor, listens to them, and you are able to identify what the problems are, and you're able to channel them on the path to go. Even if you are not going to provide 100% solution to their problem, but you are there to be able to help them, walk them through the path of getting solution to their problem. So you can see that you as a mental health and addiction counselor, you are very, very, very important to every individual in the society, especially those ones who come to you for help. So at this point, I would want to quickly round off this program, thanking each and every one of us for our time that we have contributed, and also entertain questions. If you want to ask questions, please kindly just inbox your questions and let us take them and answer them. And using this medium to also thank all our speakers, from Nurse Wana Etebo, Nurse Osunde, Dr. Alalade. We appreciate you for making out time, for shedding light to the myths behind mental health and people going through it, and what is the next thing to do. So we are looking forward to seeing you out there coming on board, and if not for anything, become a mental health and addiction counselor, because somebody out there needs you. So have that at the back of your mind. I'm sure it's going to be a propelling force, and it is also going to make you have a feel-good factor that somewhere, somehow, someplace, you are being fashioned to save your life. Thank you, and do have a wonderful and a stress-free. I think that's one of the best things we can ever look out for, a stress-free, mental health stress-free weekend. Thank you, and see you. Bye.
Thank you very much, Nurse Angela. Thank you very much, Miss Angela Chizzy. She's the head of school, CLI College. Fantastic one, if you ask me. And I want to also take this time out to appreciate all our speakers, from Miss Magdalene Osunde, and also Dr. Obatomi Alalade. We also had a speaker, Miss Nwanya Etebong. Thank you very much, everyone. Thank you very much for shedding light on the issues bedeviling most humans, which are mental health related issues. Would love to bring the entire webinar to a close. Thank you very much for the amazing 2 hours we've had. It's been a long ride, everyone. Thank you very much for your time. I know your time is so precious to you. And so for you to rent us 2 hours of your time just to have a brief conversation regarding mental health and regarding ways to cater to the mental health of people. And I'm sure you also heard about the CLI College, you heard about respective programs. If you want to become a mental health counselor, they have a program designed to make sure, okay, you go through that citadel of knowledge and also come out and be certified, so that you can be able to practice. And Nurse Angela Chizzy mentioned the fact that there are respective opportunities, there are different plethora of opportunities around this field. 300 mental health practitioners to cater for 200 million Nigerians. That's a whole lot of lacuna, whole lot of deficit for you to fill up. And you want to take good advantage of this opportunity to get yourself abreast as to how to get certified in this space. Thank you very much for your 2 hours. It's been an amazing time. Follow them on IG and find out. Join the link, click on the link. The admin is going to leave it for the next 2 minutes. So it's been a good one. Thank you very much.